Hello and welcome to the late night edition with me, Ayushman Singh Jamwa. Shifting our focus to some health news coming in from the national capital, where Delhi has reported its fourth monkeypox case. This after a 31-year-old Nigerian woman tested positive for the virus. With this, India's monkeypox tally stands at 9. That's the piece of breaking news coming in from the national capital, where we have a Nigerian national, a woman who has tested positive for the monkeypox virus. I'm joined by Rupashri Nanda on the broadcast to get the latest details when it comes to this monkeypox scare that has gripped the national capital. Rupashri, give us the details.
Well, what we have been able to confirm is that this person has been admitted into the LNJP hospital, and she is over 30 years old, and she has the normal symptoms or the predictable symptoms that are there for monkeypox, and her samples actually were sent for testing to NIT Pune, and the samples have returned today, and it has tested, and those samples have tested positive. So not very good news for the capital, because as the days pass by, every single day we are getting to hear of more cases of monkeypox being detected in the national capital. Remember, yesterday also Delhi reported 2 monkeypox cases, and today it has reported 1. Apart from that, in terms of the government's preparedness, both the central government and the Delhi government have taken note of it. There are 3 central government hospitals which have been made operational to treat monkeypox cases. Apart from that, Delhi government itself has set aside 3 hospitals or created isolation rooms in 3 hospitals that are being ruled by the Delhi government, and apart from that, also created isolation rooms in private hospitals in order to deal with monkeypox. Now, if those numbers are not huge, for instance, in LNJP, there are 20 isolation rooms. But what we are getting to hear is that if and as the cases rise, then these number of rooms are also going to be, it is going to be increased. Apart from that, when the other concern is, because it is a contagious disease, are our medical professionals prepared, or staff prepared to treat this? As far as LNGP is concerned, yes, they have been given the kind of training that is needed. And what we have been able to confirm is that the staff, the doctors, the nurses, anybody who is involved in treating a monkeypox case or supervising such a case is given PPE kits, and follows the same sort of protocols that they used to follow when it came to COVID cases. The only good news for the capital, of course, is that there has been one patient who has been discharged, and people, after a certain period of time, the patient is getting better and is getting discharged. But the bad news is, on consecutive days, Delhi is reporting a monkeypox case.
Absolutely. Rupashri, please stay with us. The COVID alarm in the national capital is not far behind as well. And that's the news that's coming in from Delhi, where Delhi's positivity rate has shot up to 11.64%. 2,073 new cases have been reported in the last 24 hours alone, ladies and gentlemen. Meanwhile, the number of deaths too have gone up compared to yesterday. Delhi reported 5 new deaths today. Yesterday, it was just 3. Rupashri continues to be with us on the broadcast. Rupashri, so this continues to be a cause of concern for the Delhi government, because Delhi was once the epicenter of the COVID surge, and now we're seeing an upward trend. 11.64% the positivity rate, 5 deaths in the last 24 hours. Decode the action plan of the Delhi government right now. Is it a wait and watch policy even now?
Well, it is a wait and watch policy. See, the Delhi government has already, set in motion its own preparations to deal with COVID cases, and it has now a kind of experience of dealing with COVID cases. Now, what we are getting to hear is that there is no reason to panic, or there's no reason for alarm as of now. And what we are getting to hear also is that the government is keeping a close eye on it, but looking at the spiral of cases, if you look at the number of cases, yesterday it was 1,500 plus, today it is 2,000 plus. Similarly, positivity rate has shot up by 1%. A number of deaths, 3 yesterday, 5 today, definitely extremely worrying as far as the fatalities are concerned. As far as the government is concerned, the eye essentially is on the fatalities. If the fatalities are under control,
Right.
as minimum as possible, then perhaps there's no reason to worry. The other point I wanted to make, Ayushman, is that if you step out of your home, you would rarely come across anybody who is adhering by COVID protocols.
Absolutely.
Even after the experience that Delhi has gone through in the past, not once but twice over. So that is also the kind. But the question is, does the government have to again bring back measures like challaning people who are not wearing masks and so on and so forth? But people also will have to take some responsibility and adhere by COVID protocols. But there is a fatigue which has set in, and more as I'm out on the streets, I get to hear that people say that they're very, very tired of wearing masks.
Absolutely. Absolutely. No matter how many times the cases keep going up, when it comes to COVID discipline, that hasn't become part of our everyday life.